Hello guys, myself Dr.Anjali and today I am talking about cervical spine. Okay, cervical spine is the most important and superior portion of the vertebral column lining on the in between the cranium and thoracic. Okay, suppose it's the cranium upper portion and it's the thoracic vertebra. Okay, it consists of the several districts between the divided into unique names. First is the cervical vertebra is even is known as the atlas, and the second is the axis in between the axis is called suppose it's a circle and it's axis and it's a atlas. Okay, atlas it's the base point of the your cervical. Triangular vertebra foramen and spina bifida is this is the where the spinous process is split and divided into two multiple spindles. Spindles form it is like that. It's a two form of the it is called a spina bifida. Okay. Next is the transverse foramen and holes is present in the between the process. There is passes and process. There is given and vertebral artery. Vertebral artery which is formed in the near to the sympathetic vein and parasympathetic vein. The main role of the cervical spine is to divide it in the support and promote the nerve movement and the head and neck both are supported and help in the rotation movement and the neck and head. Next, we will see the large vertebral is bodies is necessary because it is considered regarding to the small bitted and the bear to the load of the level of the C vertebra. The increased range of motion takes priority and over the vertebral size and rigidity. When the rigidity then stabilize and support the spine. Okay. The additional motion is the flexibility may be maintained carrying the increase your risk of the injury of the spine and associated neurovascular structure also, because it's most risky whenever you use the loading work and anything else. Okay, that time is support and flexibility is maintained. Now we will study about the atlas and axis. Atlas is the first cervical vertebra and it is the articulated with the occiput. Occiput is the upper and then articulated. I will see in the figure. Okay, how can a vertebra and what is the load and the C2 and the vertebral body and know the spinous process. Spinous process is not as present in the atlas. Okay, it is the C2 has the largest means of the where the connected to the by the anterior and posterior. Suppose it's the anterior part and it is posterior as like that. Okay, and now we will discuss about the articular facet. Articular facet is it the facet which is form in and articulate and have the movement and flexibility maintain and support of the spine also. Okay, the anterior arch contains the facet and the articulate with the dens of the axis and the secured by the transverse ligament of the atlas and it is the articulated with the mass and posterior arch of the grooving for the C1 vertebral artery and C1 is a spinal nerve. C1 is the first cervical nerve, and then we will discuss about axis is the C2 is easily identifiable because due to it is not present in the odontoid process which is extend into the superiorly and from the anterior portion of the vertebrae. The tense articular with the arterial and anterior and posterior arch of the atlas and doing so creating the medical and the atlantoaxial joint. This is the atlanto and made in the axis joint, axis and antalo, and this is called the anteloaxis joint. This is allow the rotation of the movement. It is a rotation of the movement of the depending on the torque. Okay, now we will see the C1 has the much larger and singular spinous process known as the vertebra foramen, which is